I think the major trends that started in 2023 will continue getting hotter in 2024. And as I said, AI is the big thing. AI is going to be incorporated into everything that we do. And it's going to be used very much so for data analysis, since home hope is a very data intensive activity.
Welcome back, everybody. I'm going to try and impersonate Scott Sherr today on
You can't do it, man. You can't do it.
Welcome to
Maniac.
900. Suck
You,
my
Mix a lot.
oxygen.
do you know this
Well-
boomer's cap? It's
Yeah.
a beautiful cap.
Yeah, I'm going for my Avril Lavigne Skater Boy look today. And so it's what we're going for. This is actually from Meow Wolf in Las Vegas, for those of you who are unfamiliar. That's a place we recently went as sort of our Christmas celebration at SNH, or holiday celebration, excuse me for being politically incorrect there for a second. So today, what we wanted to do is get together and talk a little bit with the crew about 2024 predictions. And so in order to kind of frame the conversation, I'm just going to start with a question. 2024, is it the year of prostate injections?
Honestly,
I only say this because it's going viral right now on Instagram. So we can back things out and just take things a little bit more seriously here on the SNH podcast.
Why?
20,
Why?
yeah,
We don't
exactly.
have to.
We don't have to.
We don't have to.
We can go down the realm of prostate injections if we want. However, this is a 2024 predictions episode. So similar to other predictions episodes, what we want to do is look at 2023, the year that was. We've already recorded a podcast on it, and take a look and say 2024, what may happen in the realm of health optimization, what technologies, what tools, what studies, what events may shape the world of health optimization in 2024. So with that, I get the pleasure of doing the bumps that spike thing, because this is the easiest job in the world, is to be the MC for this. I get to bump it up to you guys and say, like, hey, what's going to happen? If you're going to take your crystal ball, and rather than doing the cop-out answer and saying, like, hey, I see the future and it's going to be very vague,
That's my cop-out answer.
yeah, that's everybody's cop-out answer, right? Let's try and rub that crystal ball a little bit like Wizard of Oz, Kansas City, circa 1960 or whenever that came out. And let's be predictable. Predict here what's going to happen on that yellow brick road known as 2024.
Well, for my first prediction is that something's gonna happen to the prostate that has been injected with all sorts of things. I don't know whether it's gonna be good or bad, but something's gonna happen.
And just for reference, these are things that traditionally we wouldn't think to be injected into a prostate, correct? Yeah.
I was totally surprised when I saw the video, but anyway, the I think the major trends that started in 2023 will continue getting hotter in 2024. And as I said, AI is the big thing. AI is going to be incorporated into everything that we do, right? And it's going to be used very much so for data analysis, since home hope is a very data-driven a very data intensive activity, where when I started analyzing the metabolome, it would take me 5 hours to actually make conclusions, right? Can you imagine if you're able to present this to your results to particular cases that to which your large language model has already been trained? And not only that, but to analysis also of boomer loves devices and rings, and all of those data that are coming from those can also be analyzed intelligently by AI. And the other thing is that basically the arrival of the devices that are natively, including your phones, by the way, that are natively driven by AI. NVIDIA, the chip maker, has already been looking at phones to be, the next device where they're going to put in their AI chips, right? So that's what's gonna happen. So it's gonna make life either more complex or simpler for you depending on how you use the technology, right? The other thing that I know that the whole data analysis thing, that's a huge area that's going to be driven by AI. The detection of patterns and so on. And when you look at it not from a health perspective but from an illness perspective, you could now see how much of this data can be used to, for example, analyze like the epigenetic data, right? And make predictions from that. Can analyze, cancer data. But for me, the exciting part will be there will be an increased analysis of your nutrient data, your nutrition vis-a-vis your health, right? What are your nutrition and the metabolites that it produces, and then your health correlation. So that the idea of precision medicine, which we are actually practicing, because all of our protocols are for each person. It's like it's not a one size fits all thing. You could see that there will be this a lot more of the precision medicine going on, right? The other thing is that the big trend that started in a while back, but also got so hot in 2023, will be hotter in 2024. As I said, the microbiota was one that was a big trend then. You could see that the microbiota will benefit from in genetics, they have what's called GWAS, right? Genome-wide analytical studies, and those can actually be done a lot better than by artificial intelligence systems, right? And from there, we can come up with various types of, in fact, genome-based therapy. Microbiome-based therapies for various types of uh, diseases, right? Even if you're not disease-based. That's why in health optimization medicine, we're really more concerned with actually keeping your microbiota healthy. Because right now we know at least we're beginning to see what the healthy patterns of microbiota are. And the big difficulty that illness medicine has with these types of analysis is that they're looking for the disease patterns right away, right? And they still don't know what the healthy patterns are. So I think the step that needs to get done in 2024 and onwards is that what are the healthy patterns of this microbiota, right? And then from when these healthy patterns are disrupted, or the healthy networks, right, or ecosystems of microbiota are disrupted, what's going to happen? A big area within the microbiota system is actually an area that I am avidly interested in, is the enteric microbiota gut-brain tripartite system, right? On how, the microbiota in your gut is communicating with your brain, and how your brain cells is actually communicating with your gut. We're seeing more and more communication between them. They're acting as independent entities on their own. And I am sure that in 2024, there will be many more revelations on how the tripartite system actually works and can be made to cooperate or coordinate to your health and be able to actually guide your sleep. The other thing that microbiota do is that for next year's, I think there's also a huge studies underway now to see what microbiota actually affect your chronobiology or your circadian rhythm, right? And one of the big things that came out in 2023 is, hey, you should actually give your medications at a particular time of day, because A, the body is actually more receptive to it, and B, the microbiota are actually more receptive to it. And I've always been saying that the acupuncturists had known this for a long time, when they know when a different triple warmer is active and so on and so forth. But now we're actually finding it in science, and there will be more of this. So because microbiota is involved in everything else, right? In the generation of your metabolites, right? When you digest your food, and they actually pre-process your food, in your circadian rhythm, in your in the processing of your toxins and your exposome, how the exposome and microbiota interaction is going to be. So I think we've only we've just opened a big avenue. We've been opening it for the past few years, but this, I think, in 2024, we'll be seeing, the microbiota actually bleed into all of the different pillars of the health optimization medicine in ways that we really actually didn't envision it, right? And AI, as I said, will basically drive a lot of not only the studies, but a lot of the energy that it will be used in order to keep you in great health and actually, alleviate diseases or cure diseases, right? If you think a little bit more on AI, and because we're only thinking about our human health, we're thinking of sending people to Mars, for example, or we're sending people outer space for longer periods of time. If you could see the power of AI to actually determine what patterns we have, in terms of that will allow us to be able to travel for long periods of time in space. So with the advent of this technology that we have to us, it actually opens up, again, my use of the word humankind, to various types of possibilities that were not available to us before, because we did not have the capacity to analyze the data that we have. Or we do have data, right? It's just that we do not have the capacity to actually analyze them until now, and it's only going to get better. Even in evolutionary medicine, which people are quiet about, they think that there's nothing more to advance. There actually no. The microbiota actually evolved. They have an evolutionary dance with the body, our microbiota, right? From the discovery of the prokaryote eukaryote communication in 2013, right, to now, it's like, how does the microbiota content actually predispose someone to disease, right? So which is within the purview of evolutionary medicine, or for example, how autoimmune systems actually are built into our systems, right? As a way of defending ourselves from other diseases, how we are adapted to infectious diseases, right? So it's even in things that we don't think about, right? We were thinking about epigenetics, we're thinking about mitochondria and even mitochondrial diseases. We're thinking about metabolomics itself, exosomics, microbiology. But yeah, there's also something to be said about evolutionary medicine. So we have a better understanding of ourselves. Aside from what Jodi said, we also understand ourselves a little bit better by the way we interact with what seems to be like a spoiled brat sometimes when they create large language models.
All right. So at the risk of potentially like starting off on a tangential conversation, I'm going to say a two-word phrase that I think we're going to park for a separate conversation, because there's been some advances also in quantum computing, right? And so Ted, perhaps we'll park this for a separate conversation about the impacts of quantum computing on all of these potential discoveries, because between quantum computing and large language models, I think there's a lot that can be answered very, very quickly. So 2024, coming back to this, I get the pleasure of volleying.
Just like to say something funny.
All
right. Number one, first is just a serious question for people. It's like, please have a definition for the term quantum before you use it and open your mouth with it.
Right? I knew you were going to go there.
Definitions always. We got a guess.
And the second is, quantum computing. This is just a funny thing that I say all the time. It gives you an answer that sounds like this: I'm giving you a definite maybe. So that's the quantum computing for you in a nutshell. Anyway, Boomer, please take it away.
Well, I was more looking at how quickly we can calculate something, but that's okay. We'll park this for later. 2024 is also an election year in the United States, and whether or not we like it or not, it's a country that does drive a lot of trends, particularly economically, and as well as in health. And so one of the trends that came out of our 2023 discussion was the idea of psychedelic assisted therapy. In 2024, is it going to be the year that the FDA approves MDMA for therapy, particularly as it relates to PTSD? Wow, I didn't expect silence on that question. Wow.
Yeah, well, I would like to say yes, but I have no metric on that. But I would, if Australia has done this so far, then, well, watch out, America. Where are you? Like, come on,
Yeah.
we can't be the ones here.
Oh, you mean we're gonna watch the beneficial side effects of Australians first, right? What it's gonna do to the Australian culture. They'll be a lot more loving and so on. So, then maybe America, being an imperialist, militaristic country, will say, no, we don't want any of that fucking thing. Anyway, I'm kidding. It's highly effective for PTSD. It's been fast tracked by the FDA. So I think 2024 is going to be the year for MDMA.
Mm.
The year for MDMA oral. But I don't think the injectable is going to come anytime soon.
No.
So nobody's doing prostate injections with MDMA at this moment. So
not yet, until you just said it online for everybody to understand that that's even a potential.
Yeah,
it's not a possibility. Ladies and gentlemen,
please go speak to your physician beforehand. I am not a medical doctor. Don't play one on the internet. Go talk to your lawyer as well. All right. So you've heard it here first, or not first, but 2024, the year of MDMA psychedelic assisted therapy. Let me perhaps follow that with a follow-up question. After MDMA theoretically gets descheduled or rescheduled, which is probably more the latter, where do we go from there? You've seen a few movements within the United States around decriminalized nature. We can talk a little bit about the potential issues with that and around the world, really. But where do we go from MDMA being approved? Already people are using ketamine, for instance, for treatment-resistant depression. What's next on that topic to fall?
Well, I'd just like to interject here really quickly before Ted takes us down the journey. But with Susan, when I was speaking with her on the podcast, a lot of it is set and setting with psilocybin, but also with MDMA will be very important. So I think it's the pre, the during, and the post care that's really going to make this or break this. So I think that for me is really important to see how that is going to be and how it's been designed. Yeah.
Yeah, the thing about this is a very good point, Jodi, is like the training behind this, right? Because, for those of us, and I'll throw my hand up here, who have experienced psychedelic assisted therapy, the training of that therapist can have a multiplier effect that otherwise may or may not have been there. Certainly the substances themselves can be useful, but if you're sitting in a setting that is candidly fucking horrendous, that may have adverse outcomes. So I am interested in how the training gets implemented. Of course, how we supply these molecules across the world is also of interest to me. But Ted, I'm going to volley it over to you to talk about, how we see this rolling out, but also, either hurdles or potential other molecules that you might see come out soon after MDMA.
I just like to say briefly, I actually love Rick Doblin's slogan, right, about MDMA. He says, trauma-free by 2070. And, that's some fantastic, catchy slogan. It actually, if we just go just a little bit historically here, a lot of the molecules that are already being used in therapy before, or were not actually scheduled, right? Just get swept by Nixon under that act, and was never reviewed again, right? It never got reviewed again, and then the people got brainwashed on the Just Say No Fuck movement, and and so on, which was really political and not scientific. And that has been the point of MAPS this whole time, right? Those are political decisions those are actually not scientific decisions. But the real problem that we have is that we actually have no more drugs to give for many of the mental conditions that we have. So why don't we go back and review what we have politically just stashed in there and not review ever again, right? And that's actually that attitude was a long time. I mean, Rick Dublin's been working on this since 1980s and mid 80s, right? So it's a long time to be able to undo, something that's been political, something where at least two generations have been affected. I can't imagine like kids right now who are not even willing to try, one psychedelic or the other because they just lump all psychedelics as bad, or
You were listening in on my family conversations at Thanksgiving, weren't you?
or they just lump all psychedelics as addicting. I said,
Yeah.
my fucking God, DMT is addicting. You must be out of your mind, right?
Yeah, I mean,
But
David Nutt kind of disproved this a while ago, right? So,
but the one thing that they're doing that's actually very, very interesting was the DMTX experiments that they're doing in the UK, right? Where they're able to hold you in that DMT space, right, for hours at a time, and it's something that could not be done before. And remember, we are now really, a lot of this is actually reviewing what these things do because we've totally run out of things to give, right? Even when I was talking with Carl Friston, he was actually delighted that I was working with GABAergic systems. And he said, that may be the key molecule that we're missing to look at in schizophrenia, for example. So for me, in terms of although we're in the health optimization space, what's going to drive more of the studies of these molecules will be the need for them in clinical and medical settings, right? As I really cherish what one of my psychiatrist friends said to me when he asked me to help take out, his patients off the antidepressants. He said, Ted, we're actually so good at giving this to our patients, but we never know when to take them out. And exactly, we do not know when to take them out, right? And the truth is, they actually get offended if you begin taking them out, right, and giving them a little bit more of the natural substances that can actually help them or balancing their bodies. Like, for example, I do when I do hormone balancing, I get a 40-year-old who is very angry and he's already on like a couple of antidepressants, and yet on 3 months of hormone balancing, I mean, not just testosterone, but hormone balancing, he's back to his old self. I mean, that's part of growing old, man. Your hormone levels drop down, and it's like our solution immediately is to treat what's going on inside us as pathology instead of a natural process that actually happens to us, and we can shore up these things. So as when you said, what's different in the criminalized nature and so on, that's a very slippery slope, right? Because we are nature and we are in it. And one of the things that the United States has done really badly for this one is that it treats its entire population as if we're all elite athletes, right? They actually just banned all of these drugs and substances, et cetera, as if we were all competing in the Olympics, or that we were Barry Bonds or Marion Jones and all of these other people. No, we're not, right? And so it's actually quite funny that for like the 0.00 something percent of the U.S. population, this group of substances are banned. That's fucked up. It's like, seriously. And so
in Australia, it's worse, I believe, right, Jody? Like, you guys
Definitely
can't
worse in
even get
Australia.
you guys can't even get CBD. Like,
I mean, right. Look, we have an endocannabinoid system in our system, which means that we respond to exogenous administration of these things, right? Well, of course, we have opiate receptors in our system, and that's gotten
one of the
into
things that I actually want to bring up here is that Kentucky. So Kentucky is not the first state that I think of when I think of psychedelics. It has a $42 million grant, which is sort of an odd number, for ibogaine therapy and its relation to opiate use disorder. So I was like I was pleasantly surprised, also kind of sending around to my family being like, hey, look, even Kentucky is looking into these things. So I am excited. Going back to decriminalized nature, does anybody want to make the point on peyote? I guess my positive view of
Yes.
decriminalized nature is it's sort of a way that politicians and the general public can start to understand these, and it's a way to pass them through faster. But the flip side of that, I mean, everything inherently has a cost, is something like peyote. So just
Mm.
going on the decriminalized nature point, does anybody want to jump into the peyote cactus and how that might get affected here?
That was actually a big issue here in DC because we have one of the first decriminalized nature movements has actually passed all of these things, and we want to pass them hook, line, and sinker, right? However, they had to make an exception for the peyote peyote caring tribes who actually use peyote as a part of their rituals and part of their care and so on, because it was being poached, right? And that actually, although I agree that they should be protected, I think that exception will just breed other exceptions, and it's going to be a slippery slope from down there. It's like, for me, it's just like what Dennis McKenna said. All of us have DMT in our systems. We should all be hauled to jail. So, we all have testosterone, all of these hormones, and so we're nature, right? We're nature. And for me, anything that's natural, that occurs in you, there's no point in actually banning these things, right? It's the synthetic parts that are not that are not bioidentical, that are not identical, are the ones that actually merit closer scrutiny, right? And look, we have a fucking lopsided view or value of these things. It's like, yeah, if we have alcohol that's legal and kills so many people every year, not just by drunk driving, but by cirrhosis and other stuff. You have refined carbohydrates, right? That cause diabetes every year. Ban those instead. I mean, seriously. Well, you know, and it's like
Absolutely.
the criminalized nature movement, I think, should be true to the spirit of the criminalized nature. I know I'm going to be hated by many people for this because I'm politically incorrect, but when you make one exception, that's it.
Yeah.
It basically opens everything else up for another exception. I mean, hell, you can make synthetic fucking mescaline, so instead of doing poaching, etc., why don't you just make synthetic mescaline available? It's the same structure, same thing, does the same thing, rather than making them steal the peyote here. Here's synthetic mescaline. There's no difference. But anyway, that's just my point of view. I guess you're also, of course, after the ritual of giving the peyote and so on and so forth. I've had the ritual. It's beautiful, but I have a scientific mind and a pharmacologist mind. It's like, no, I just want the active ingredient here. I don't like all of these other. It's beautiful, beautiful ceremonies, but I don't need the ceremony to get what I need out of it. Right.
Yeah.
So that's I think that's my point of view in terms of the decriminalized nature. And we need to think really very clearly on how we want to proceed about this, especially 2024, when all the other, like MDMA is synthetic, right? LSD is synthetic. So we should think about these other things that are natural and where we actually want to bring them.
Yeah, and I think LSD, MDMA, ibogaine even get lumped into the to be research further category when you start to have the decriminalized nature conversation. Now, I want to just call somebody out here because I know she has to run here in a little bit, but Jodi, look, 2024, it might seem like a long way away. It's only what, 7, 8 days, depending on what time zone you're in. But what does 2024 look like for Jodi Duval? What are you excited about? What scares you? All of those fun things. What are your predictions?
Well, I want to bring it back to health optimization, medicine and practice, because for me, it's been this 2023 has been a big year of seeing multiple people come on board. So it's been a pretty big practice year for me in Home Hope. And I've had, 6 people, families being all tested. So I think I feel like I'm getting my groove with this, and I feel like people are getting their groove with this. And
how Jodi got her groove back. Here we go. This is the title of the episode. All right, here we go.
But I feel that is spreading very fast because people are realizing that this beautiful dashboard that we can create, and the personalization around things that we never knew that we could test, and now that we know, and there is a set timeline, guideline, and then people are seeing results. I'm hearing the majority of people saying that they have never felt better in their life. So that is the key thing to give people that feeling of wellness, of health, of vitality, and they have that to go forth in the years to come, to know where to come back to if they lose their way again. So I feel that next year is going to be a massive year for people realizing that this is the thing to do, the prevention. So the prevention space is going to grow, because already I've seen it come this year that people are, well, there is no other options now. They're not finding other options in healthcare. Now it's true healthcare, and that's where health optimization comes in. And not to completely blow our horn, we're meant to be doing this, but this is, like, I see this is coming. This is coming hard and fast. It's
arriving.
Yes. It's arriving.
Well, never mind. I'll hold on the joke there.
Well said, Joe.
No, the joke is easy to say. We're tantric. We don't come, we arrive.
That's on my holiday book list. Lots of tantra books. So
wow. Okay. Holiday book. We went there. We should have a separate episode on 2023 book lists.
Holiday book list. Okay.
Yeah, I have a book on the history of New Zealand here, and you're reading books about tantra. I mean, that's a whole nother world. All right. Very, very cool. Yeah, I agree. I love how you put it, Jodi. The arrival of this database dashboard. It's, for some of us, we've been using it for a very long time. For me, as a nerdy finance person, I've called it benchmarking most of my life. But for the rest of the world, we're getting introduced to this. It's a great time for people to realize that health is a long-term project, and it's both a preventative and proactive participation on somebody's part. And there are few places in the world where you can get that right now. You
are reading a book about New Zealand? Liar! I thought you said you were reading the heart drops of the Dharmakaya.
As you know, Ted, I can't do one thing. I can't read one book at a time. I have right here. I went to a bookstore today, a market here in New Zealand, and said, "Can you give me a book on New Zealand that explains life before the white people arrived?" Right. And this was sort of a protest that I had after going to a museum here, and it was presented as such that nothing happened in New Zealand prior to colonization. And so,
that's the story of United States too,
yeah,
right?
Basically, right? Like, welcome to Thanksgiving. But it's just it is a tome, and so I look forward to digging into it in between different passages from Heart Drops of Dharmakaya, or a multitude of other books that may or may not be related to tantric practice. But anyway, going back to Jodi's book list.
Homo practice.
Yeah.
It's a theme. It's a theme.
There we go.
It's a variation on a theme, as we say.
And so the person with the OnlyFans type voice has been very quiet over the course of this episode, which is frankly rare. In fact, for you to be quiet like this, I was slightly concerned.
His blood sugar is up.
Yeah, I was actually concerned. Are you okay? So Dr. Sherr here, I have to ask, are you okay? Are your vital signs all right?
No, everything's good over here. There's just a lot of extraneous activity that's happening behind the camera. And it's a Friday night here, right before the Christmas holiday. So I think other people listening can understand. But no, I'm good. It's been nice to hear predictions. And it's always great to hear Ted, the futurist, talk about these things, because he's been talking about AI since the 1980s and anti-aging and reversing of biological markers and all these kinds of things since the early 2000s. So a lot of these things are finally coming to fruition at a rapid pace. So I always like listening to hear what Dr. Ted has in store for the rest of us. What we're going to look forward to. Maybe
you're
not next year.
synesthesia now, synesthesia, right? So you're listening to
Indeed.
see. Yeah,
I'm listening to see. I am on drugs. That's true. I did take something before the podcast. I don't know what it was. It was one of the things in my refrigerator that was unmarked. So
yeah, it's called berberine.
Hey,
Bring your blood sugar down.
That's not my fault. Okay.
No. I just thought I thought it was berberine to bring the blood sugar down, but that's okay.
Yeah, I never actually got the cake. It's sad, but that's okay. They left before they got cake, so no cake tonight for me. I think I'll be all right. But yeah, for my 2024, I have a lot of things that have been on my mind as you guys have been talking, and I've been listening mostly, unless I've been distracted by children. But one of the things that Jodi, you were mentioning, I think I want to kind of dovetail on your practice growing and kind of finding your groove. And I got to feel similarly here in Colorado where I'm at, and how I'm really ready to kind of take the practice to that next level and continue to grow it. And I was just looking at some statistics earlier this week and how many people are actually leaving medical practice from the physician side of things. It's much more difficult to be a doctor these days within the system, especially if you're a primary care doctor, if you're a family medicine doctor, internal medicine physician, pediatrician, if you're on that wellness side or like the first side of the preventative side that you'd see in the conventional model, those jobs are being replaced by physician extenders like nurse practitioners, physician assistants, even nurses now. And so doctors are looking for things to do and are getting stuck in these bubbles of these 15-minute visits, which have been going on forever, but just been getting worse. So I think there's going to be more and more interest, especially after COVID and just the huge surge that we felt as a community here in the health optimization world, that people are looking for alternatives, both as patients and also as doctors. Like, well, shit, I got to keep myself healthy through this pandemic. I'm obese. I'm not checking my blood pressure. I'm not getting any exercise. And so I've had a lot of doctors reach out to me over the last 6 months or a year and say, looking for alternatives. And I spoke to one just earlier today. He's an obesity medicine doc at Harvard. And he's like, I'm looking for something else to do. I don't want to just do obesity anymore and just work with these drugs of the world, which are great and they can be really helpful.
We forgot to talk about Ozempic in the 2023.
Yeah, that was
Jesus.
Yeah, that's true.
I missed that
one. I was thinking about that for 2024 at least to continue to. Yeah. That's going to continue to be a trend as we see here. But so I think we're going to have more and more people that are going to be interested in looking for alternatives outside the conventional health space, looking for true preventative health. And we all know that the system is broken. I mean, I'm still in the system part of the time, and I know how broken it is. If you have a trauma, it's good at that. If you have an acute issue, we're pretty good at that. But it's a meat grinder. We just churn people in and out, and we don't do much else for them. So I think you can see much more interest growing in the work that we're doing. And as the nonprofit is growing and we're training more people and we have more of these cohort groups where we have groups of people that are training in our program on a regular basis with the faculty, the people that are here on this conversation and others going through the modules of the health optimization practice essential certification, we're just going to be starting and continuing, I think, exponentially this wave of health optimization, because I think that's really where things are going. And Ted, again, the futurist, starting this back in 2009, and things took a little while to get rolling, but I think we incorporated the nonprofit in 2017. But really, I think the year of Home Hope is really going to be 2024. We're going to see that inflection point for a lot of things. So I think that's one of the major things that I see happen in 2024. If you guys want to comment, I can also go on some other things that I have ideas for 2024 otherwise too.
No, keep going. I want to keep the rolling stone rolling.
Yeah. So I think there's been a lot of emphasis the last couple of years on longevity.
But gather no moss.
Yes.
I don't know why I reference. I actually do, because I just bought Rolling Stones tickets. But anyway,
yeah,
nice.
Keep going
with your mom, right?
Yeah, mom, dad.
Go with mom.
We're all gonna go hang out and watch Keith Richards do his thing.
Making Keith.
Yeah.
Sorry, Boomer. I just couldn't resist. For people who don't know the expression, a Rolling Stone gathers no moss. But anyway.
Yeah, you went highbrow with it. I went sort of middle of the road.
But I could dovetail this and talk about the ultimate biohacker, Keith Richards, right? He was the first guy that was going to Switzerland back in the 1970s and getting his blood cleaned.
He slept upside down for a couple of years, right? And that was
all these crazy things. Yeah. None of it. We're not really sure if any of it is true, but I think partially some of it has to be, because he's still fucking alive and somehow.
I got to resurrect vampirism, Scott. I tell you.
There you go. All other types of vampirism or isms or whatever it's called. Yeah. But anyway, so I think there's going to be a huge continued emphasis on longevity. And we talked about Brian Johnson for 2023. And I think we're going to seeing more of this kind of trickling down to the regular folk that want to have additional things involved in their life with their focus on longevity. I mean, we certainly see a huge trend in 2023 and also going to be in 2024. People aren't drinking alcohol as much, thank God, because there's alternatives, and we know how terrible alcohol is for us now. So people are looking at, I have friends that have these places called social wellness clubs where you go and you hang out with your friends, but you don't drink alcohol. You have adaptogen cocktails and meditate and do sound baths, and it's all very LA. But this is extending outside of just
No,
LA
it's not
too.
just
So,
LA anymore. It's
I know.
Yeah,
older.
yeah.
It's right.
Don't
It's
they make
actually at
fun?
Scott's house. That's what's going on right now.
Don't they make fun of those in the movies already? There was like one movie I saw where instead of like doing all of these things to their skin, men are now going to sleep and they're like washing their faces and applying all those face lotions and
and putting a red light mask on.
and yeah, wearing
I
face masks.
it's funny. I should have done this podcast episode with a red light mask on because I have one right behind
Do
me.
you have one?
Yeah, of course.
Yeah.
Of
course you do.
Yeah, of course.
Awesome.
So, but
Yeah.
we also are going to do a sound bath and all of the sort of gong thing after this too. So
Yes, a drum circle. Those never get old as well. So yeah, for sure. And then two more things that I was thinking about as you guys were talking. One is a study on methylene blue for Alzheimer's. So that's coming out. Hopefully we'll get some reports of preliminary results and information in 2024. Very excited about that for low dose methylene blue for cognitive impairment, Alzheimer's. This is based on a study that was done a couple years ago, looking at multiple different levels or dosages of methylene blue, where 16 milligrams a day was actually the placebo group versus 150 and 250 milligrams a day. And the 16 milligrams a day did much, much better overall on cognitive scoring. So very excited for that. And then finally, it would be, and you mentioned this also, Ted, but just to emphasize, I think 2024 is going to be the year of the forgotten neurotransmitter, GABA.
boom.
Everybody, yeah, so dopamine and serotonin, they were 2023, 2022, whatever, Facebook, Instagram, all that, whatever. Now we have GABA turning the brakes on, and 2024 is all going to be about slowing the fuck down and understanding that GABA is the key.
Yeah,
Beautiful.
you used the term "the fuck down," and I now know quite a few people who actually use a quarter of trochum, which is GABAergic, as you know. You guys know that Prescriptions is a company that's the major donor to health optimization medicine and practice, and I had intended trochum really to just use the same receptors as the benzodiazepines do, but in a natural way, right? And then a friend of mine just told me that for performance anxiety, he actually takes a fourth of it. I mean, he's of the age where he shouldn't have any problems or any issues, right? But he said, then a fourth of it, and I'm fine. And now there's about 5 of them who's actually said, "Shit, that thing works for performance anxiety." I said,
We get reports
"Well,
of this all the time.
well, that's not what I made it for. But hey, if it works for you that way, fine." I said, I think that where you should use this for is where the United States economy is going next year.
That's kind of that. Like now we're starting to get in my type of 2024 predictions. Here we go.
Yes.
Yeah, over to Boomer.
Yes.
Yeah.
And then now we're going to Boomer because that was my
Yeah, I don't want to be Debbie Downer here, but in the year that Charlie Munger passed away, I think I have to give a shout out to my high school yearbook, which my senior year quote was from Warren Buffett, and it's only when the tide goes out that you know who's been swimming naked. And so, with that in mind, I do think there are some interesting forces in the mix right now that could potentially cause disruptions to global economies, which we haven't as a society seen what this will actually do to a longevity health optimization driven market. And so with that being said, it's at those moments that you figure out who are the best are, because there's ultimately a flight to quality in terms of both products. The products that you use, you're going to spend only on the ones that you know that work. You're going to spend money on the behavior changes, the practitioners that really drive results. And so in a world that is potentially changing very rapidly, and may or may not be positive way, you may see it will be very interesting for me to see how this particular sector, and that sector being health optimization, longevity, whatever you want to call it, responds. And I think for those that are concerned, it's a time to upskill, right? And to really increase your capacity both as practitioner or as a client or patient, and really to understand a little bit more as to how to be the best practitioner possible. It often it allows you to kind of gravitate towards those frameworks which do withstand the test of time. And so those frameworks to me, as we kind of touch on trends that are going forward for the next several decades, are things like artificial intelligence, data science, these omic structures. And so as the world potentially enters a period of economic uncertainty, which may lead to different behavior changes to how we look at health. A lot of these practitioners who have been providing, not just practitioners, but influencers who have been providing sort of chauffeur level knowledge might fade away, because all of us who are really paying attention to where our dollars are going to allocate those dollars towards people that are high quality, who are able to deliver the behavior change, the health solution that you want, and the products that are really going to work. So I don't want to end this on a Debbie Downer note, because I think it's good for anybody listening to this to know that just by educating yourself, you put yourself in a position to have a little bit of a swimsuit on rather than being caught naked when the tide goes out. So shout out to Charlie Munger. He's done a lot for me and sort of how I look at the world, and, rest in peace to him. But yeah, I can toss it back to you guys so we can wrap things up here on the 2024 predictions.
Well, I just like to put in the silver lining. If you're one who is has enough optimism to put silver linings and look for silver linings,
We're not talking
is
about
that
silver linings playbooks here, right? We're talking about
no, not that one. Is that as Boomer already mentioned, is to educate yourself, and I hope whatever happens in 2024. If it's going to be a difficult economy or not, what we need to do is to use this to use whatever happens as motivators that drive us to learn more about ourselves. And in particular, I think what's going to happen next year, if the health dollars are going to be contracting, I think what we need to do is to educate ourselves at how what we eat influences our health, how where we live and what we surround ourselves with, the light, the water that we drink, the food that we eat. These are the kinds of things that have a direct impact on our lives, right? And most of all, the relationships that we have with not just other people, but with things that we have, with the events that we attend, and so on, right? So those I hope would be educational touch points for all of us, whether or not the health dollars are increasing for ourselves or contracting for ourselves. Just use those as motivators to learn more about what makes us healthy, what makes us sick, what boosts our immune system, rather than fighting about whether or not a vaccine is good or not. Let's take a look at what are the best ways to shore up our immune system. What are the best ways to decrease our allergies to things by examining, for our gut lining and seeing how inflamed it is from the foods that we're eating. So these are a lot of little things that we could actually do just by being aware and using whatever positive stress or negative stress that surround us or within us, right? To actually learn more about what makes us tick and what makes us healthy, right?
Amazing. All right. Any final words of wisdom for the crew? Otherwise, we can wrap things up here and call 2024. It's already done. We've looked into our crystal ball. It's not vague. It's crystal clear. We've got a lot of positive things to chat about over the course of the year. It sounds like, whether it's generative AI and us having a podcast no longer with Dr. Ted, but with Dr. Ted, the bot, the replica. So this might actually be Dr. To's last podcast. So, thank you,
It's
Dr.
wonderful
Ted.
knowing you, Ted.
Yeah,
Thank you for being here.
it's been wonderful knowing you. Thank you for your contributions to everything. We look forward to indulging your replica in conversations in the new year. But whether it's generative AI replicas or agents or MDMA assisted therapy, there's a lot to look forward to in
Yeah,
2024.
no, I thought you were going to end that sentence with there's one thing you can be sure that generative AI replica of me is going to say fuck all the time.
Once every 3.5 seconds. All right. So on that note, everybody have a fucking good 2024 and have a
Good to
wonderful
hear.
rest of your 2023. Signing off. Please stay equanimous. Have a happy new year.
See everyone.